Good afternoon. I You saw what I posted. Please, I'm happy. Some people are still arguing whether they will join or not, while others have already made their notes. Yes, that's a good step. And unless you read into that topic, if you actually read into what you are copying, you've read that material once. I'm going to let me finish. No, I'm giving you clue on how it happens. It's not by magic. Properly read meaning into that thing you are making, copying, whether copying or making anyone. You have read it what once. If you now realize you are ready for the second time, do it again. If you go to it again and you are in a lecture for the third time, and you do all your assignment and your quizzes in that course, it's not magic. It's not magic. Okay, keep dictating because I went to the put that was dictate that I understand. So, but okay, so I have 2 hours and 8 minutes. You that I say Nigeria. Even as medical says, well, yes, yes, I am pharmacists are working for me. I may just get pharmacists maybe reps. Are we together? So they also work in community pharmacy. Even some of you here have already started working in pharmacy technician. True. I can put you now. I know many of you. I should put clinical Did you bother to find out this? Find out and tell us. Pharmacy what? Technicians. They rely on what? Pharmacy what? Technician to expand their what? You can train, but there's nothing. It's not everything that training can do what? Do. Am I communicating? Yes. That training pharmacy professional to start performing pharmacy task is somehow is dicey. The person will have very litany of limitations. Am I communicating? Through this what training, you can never compare two of them. You can't compare two of them. I said it. So what for the moment aside, but just what did you see? From me, That like they can buy the job. Read for don't worry. What did you see? Feel free. These are services that allow patients to receive their prescription medication through email. Through what? Email. Is it clear now? Yeah. Is it clear now? Yeah. For you, may depend on the type of responsibility given to the pharmacy technician by the pharmacist there. May in that pressure Am I correct? For hours, you equip yourself so that you be able to take care of one or two things in the absence of what, because you saw how your pharmacist will leave you and go out, and the patient comes, a client comes, and you're not able to say anything, and you're looking at the person like a robot. You not come back again. Three of us, the person will not come back again. There are one or two things you can do. Then you can also communicate with the pharmacist in case you miss some people as may issues with. Am I communicating here? So you have your reference books in front of you so that you can easily look up what you don't know. Are there people that indicated interest on the MDEX? How many? Once it's up to 10, once it's up to 10 and they are ready with their, yeah, so let me know so I can transfer them so that they can supply. They supply on what? Payment before supply, yes. So I so it looks like MDEX now. You can keep it, be going through it. Now, not even when you are done. Now, if you encounter one or two drugs, maybe when you start doing your AUL in your second semester, maybe you start treating anti-ulcers. Am I communicating? You could say maybe if you mention of proton pump inhibitors, you go back to that reference book. Having gone through your textbooks, you also go to the reference books and see what you have there. See the brands available. See a lot of things about the pharmacology of the world, the drugs. It will help you to appreciate what you are studying. Am I communicating? Even if you are not opportune to visit a pharmacy now, by virtue of even their pictures alone you are seeing, their strength, the brands alone will help you to appreciate what you are doing. Am I communicating? So huh? No, it's not stock taking. The stock, right? The pharmacy, it can be the medicines you have, medical devices you have, before you are what? Inventory. Am I communicating? Inventory control. If you should be able to give in our last class, I told you as a pharmacy technician, you should be able to give your boss you are working under up to this information what you have. Am I communicating? The movement of what you have, how it should be so that this is your computing. Yes, you work with pharmacists. It's not only a clinical then about you sit down now, look at it. Then if it's okay, after the costing and the payment, you can what fill the what prescription. So, then sometimes in as much as it's not small things you can do by your training of teaching you drug dosage. You should be able to tell a patient, take this. I'm not communicating. Take this daily. Maybe especially when your pharmacist is not around, or when your pharmacist maybe has trust and do that because he or she has accessed you and allow you to do all those things. You equip yourself first before you can trust. Two of us. That is it. I'm teaching you now. You are you prove, maybe after here, you prove to me that you have actually do what? Learn something as improved. That's when I can beat my chest and say, this person, he or she can do what? Handle this what? Responsibility. Ideally, pharmacy, in every pharmacy should be there from morning till night, even if maybe they can have shift or whatever. In ideally, but in reality, it's not like that. In reality, so some pharmacists would like to get a pharmacy technician because they trust that at least that person passed through the same training for 3 years. At least he should to do one or two things. Even if he find it difficult to do it, he knows what to do, how to source it. He knows about reference book to use. If you open a reference book, if you as a pharma technician open MDEX now, the way you are seeing content of MDEX will not be the same thing with someone that learn how to sell the drug will see the same MDEX. True of us, it will not be the same way. Am I communicating? That's what the training is given to you. A question about one or two drug, you are giving what? Drug what? Information. True of us? Yes. Please, can this thing, can I have ulcer, can I take this? You say no, this is an NSAID though. This one will make your ulcer to get worse, to get worse. So please don't take it. Or okay, you want to take antacid, okay, take it so time before meal or so time after meal. You are giving drug what? Information. Am I communicating? Am I communicating? This one will make you to sleep at night too. I don't know, or that do you drive? Maybe the precision has maybe chlorpheniramine or most of these antihistamine that causes drowsiness. And that's okay. Do you drive? You say yes. So okay, please don't take this. Take this before to make you to feel what? Drowsy. Am I communicating? You are giving what? Drug what? Information. And you cannot give unit dose dispensing. Do you know what is unit dose dispensing? Now it's a situation where you know up to mainly in hospital. That is mainly in the hospital. That situation whereby after prescribing and the costing and other things, maybe the patient is in the ward. Now when it's time for social drug to be given to be delivered, there should be a kind of small shelf, or what is it called, cupboard, in each of the wards where the pharmacy technician will now go when it's time to give social drug. The pharmacy technician will dispense that quantity that is needed for a particular dose. Am I communicating? Yes. To be given, if it is the one that will be injected, if it's for if whether it is injection or tablet or capsule, whatever it is, whatever dosage form it is, when it's time, the pharmacy technician goes to the ward, serve, give all those drugs maybe to the caregiver or to the nurse that will be able to do that. Am I communicating? Now that's what we call unit dose dispensing. We call it UDDS. It's very, very good because it helps in monitoring what is going on. UDDS. Yes, UDDS. But you know, because of lack of manpower or lack of, so we don't have enough in it, because we need more hands to be able to do what? Before you can practice that, do that unit dose dispensing, you need enough hands to do what? Now, if you have worked in the hospital, do I say that nurses but because of what is going on now, and they will come and start. There will be small cobweb in each of those technician goes there under the direction of bring that so amount for a particular dose, and it will be served to the what to the what patients. Am I communicating? It's a very good thing because it helps to monitor exactly what is happening. With that, you can actually monitor drug therapy. So it also helps you monitor documentation, billing, cleanliness, and more. If it's an establishment where you have people only that, it's okay. But when for it plain, they're able to tell you that. I'm not communicating. But if it's where you have odd lists that are attached to what different units, wonderful, good, it's okay. But you know that it's not everything they can do for you. They cannot come and start dusting your chef for you. Some of us, they cannot come and when you are working, maybe packets of medicine are scattered in the form. They're not you can't expect them to come and they do that for you. Am I communicating? They may just come in the morning, do the first one and go. Other thing that happens in pharmacy with regard to orderliness, cleanliness is your so called what? Responsibility. Are we together? Yes, now, so what happens in the community farm setting? What happens? As I said before, the first the first addition I mentioned is that I told you that they interact more with patients. True of us, we are in the what community than we are in the what hospital. Yes. So health talks. So if you are well equipped in that area, of course, by virtue of your training, by the virtue of your truly pass through you can stand before any type of audience to talk about one or two things about what health. Altogether, yes, you can research on any topic that has to do with health and be able to talk before any type of audience by virtue of your what training. You should to do that. So, community pharmacies or pattern medicine in a particular community, once in a while you can organize health talks and go there and speak to them. It may be in the church, it may be in the market square, it may be in schools. Am I communicating? Yes. So now, of course, I made mention of what pharmaco what vigilance. I made mention of what pharmaco. I didn't mention of pharmaco vigilance. They can also help in reporting that. Am I communicating? Yes. Maybe they come with I told you about the yellow DDC at the back of what I told you about it, right? That pharmacovigilance document. Copy. Keep close that in your copy. Keep your pen.
She don't have a phone. She don't.
You say what?
She don't have a phone.
Stop copying in my class, please. You have other time to do that. If copying is more important to you, then you can go outside and start copying while lecture is going on. Feel free, but not in the class. Okay? If you must put down something, you listen. See, look at what I'm saying. Look at the material you have. See, were you taught in orientation, no taking in class? Were you taught that in your orientation? Were you taught that in your English 101? Have you taught that? Please, in class you take notes. Sometimes what you have in your material, as an explanation may come, that is not exactly what you have in your material. It's not the time to be copying what you have in your material. It's time to be looking at what you have in your material as the lecturer is explaining. If there's something else, lecturer says that he is not here, you put it down. You put it down. So at your anytime you want, you can copy. But the one lecturer is saying, if you miss it, you have missed it. Note taking. Every explanation that I can do is not possible. If I start putting everything here, if you come some, two of us, is the main here. Then that's why we call it. That's why I'm here. I'll give you different examples to explain what is here. You put it down. Then what you have here, where you want to study. If you what? What? Responsibility, and they are complementary. They are what? Complementary. What this one is doing and what this one is come together to have a better pharmacy. Task together. Now, why pharmacist on the other hand look up to who? The pharmacist for what? Guidance. For what? Guidance. Very important. Very important. Very important. So they are the importance of the two. You know, the two. Pharmacist and pharmacist shall work together. There's always a better pharmaceutical services rendered to what? They're not there to start fighting or start dragging who is who. Is it because you spent 5 years in the university? I will not hear a word. Pharmacists will say, look at this one that just did. I don't even know what they did in their school, and you are here. you are killing the what profession. Am I competing? Killing the what profession, because at the end, so when the rules, not what patient safety and what good health. So I have mentioned it here. Even I've mentioned here that there should be what mutual what respect. Respect. Nobody should, pharmacy should not look down on performance technician, and pharmacy technician should not also start doing what, raising shoulders for pharmacists are the actions of what that problem. Have you not seen why, if why he wanted to sit down one place? Have you seen why he wanted to do this, do that? Do you know why? He knows that he will not say, hey, it's my technician that did it too, I'm free. You're not free. You're not free. So he won't allow you to do nonsense. That he's responsible for your work. To lead to this direction, you have a shitting out. Unless when you face the panel, it is clearly clear that he did all he could to ensure that you will not do this, and you end up what doing that. It's a reflect not together with proofs and what evidence. That's when he will be what free. If not, he will be dragged into it. He will go there and explain himself why somebody under you did this, but you don't know what you are doing. True of us. So that's why he knows one responsibility of your what actions. So of course, communication patient care, keep your issues aside and work. When you are done in the office and go, you can continue outside the work environment. Am I complete? But once you are working environment, know that whatever you are doing, when two elephants are fighting, the grass will do what? Suffer. So keep whatever malice you have, do your work. Maybe he will talking to you. So person, bring this thing. Get that between the zoo. You do as if you don't hear him. Or her. You just go as if you don't hear. The patient is there waiting. Sometimes out of anger and animosity in your heart, you may even go and get another one because you are, as in, you are boiling within you. No, at the end, the patient will do what? Suffer it. So that's the issue, the area of having what clear what communication. I will repeat it again. Any errors or negligence by technicians will be the pharmacist's what responsibility. It's a very serious thing. It's a very serious thing. It's a very serious thing. So let's always have it at the back of our mind. Unless you want to send all the pharmacists to jail, you go and be doing nonsense. Are we together? So that's why the pharmacists have to verify the accuracy of whatever you are doing. The pharmacists verify the accuracy of all the pharmacy technicians' what action to ensure that they work with the full scope of the what they practice. Are we together? Very important. So it's a teamwork. It's a teamwork work. It's a teamwork with everyone having his or her own what responsibility. Let's assume. Okay, let me give you last in our last lecture we are talking about report, right? Report. Someone was talking about sending reports. Then maybe the pharmacy will be busy with a lot of clinical activities. Let's assume the first have a lot of clinical and need clinical decision on drug therapy. You don't have time to start gathering all those things and start getting information and start checking number of drugs that were dispensed. All those things, no. Two of us, then you are going to do it as what a pharmacy technician, and it's a report that you need to submit at the end of every month, maybe for a program. Let's assume maybe all these heart to heart program or tuberculosis program, you know, all these program. Now, you know, pharmacy may not have the time to go and start. He is busy with the patient. Two of us. Now, because you are careless, you go and you are tired. You don't want to give report. You close the eyes and give any figure you like, because you don't want to start going through the prescriptions or folders or medication orders to get the exact quantity that we are giving to the patient. That's what is called grief. Who has worked in ARV heart to heart before? Here. Who has worked in heart to heart? Maybe as a pharmacy assistant. Who? Raise your hand now if you have. Okay, you have not. Okay. There are this monthly report they give. Just because you don't want to, you are tired, not even tired, you are lazy, you don't want to work, you go and start formulating figures so as to give. At the end, the pharmacist will now sit down and use the information you submitted to synthesize a report and sign and send. Who do they know? So that's why we should. Maybe the pharmacist did something you don't like. Instead of it to sort things out the pharmacist, he will send it to go and get a report. You do what you like because you are angry. No, it's not right. As you know this, remember who is suffering it, the patient. The program need to see your report so they know what they should send again. True of us, there are a lot of, if let's even use HIV drugs, ARVs, if not for all this program, I don't know how people would have gotten money to buy those drugs. Then you sit down because you are angry with one pharmacist and doing nonsense. Then when they now send, look at it, they may even be angry at what type of stupid nonsense report is this, or they may even, because it's from the report you send, then they will know what they will send, the amount to send when they are sending the next one. Maybe next time you will not even have any medication to give. Then your patients will start dying because of one. Because the first told you sit down, don't go. You become angry. I want to go for wedding. Don't go. Sit down. Don't go. Let's work. We have work. You become angry. You start doing what you like. No. So far, you have people your work is affecting other people. Calm down. If you have personal things with the performances, you can sort the personal difference. But once it comes to work, focus on your work, because you are there to do what? Save life. You are there to do what? Save lives. Are we together? Now, of course, just as you have the right hand and the left hand working together, pharmacy technician and pharmacists are like that. Left and what? Right hand. This left hand can never open your mouth and say that right hand, I don't need you. It's not possible. If you say you don't need me, don't worry. Come and wash your hand and eat. Come and wash your hand. That's when you know that the left hand needs what? The right hand. And the right hand needs what? The right hand. So the left hand will wash the right hand. The right hand will wash what? The left hand. Are we together? So this is how we should work with pharmacists and pharmacy technicians should be working together. At the same time, everybody knows his or her what responsibility and limitations. Are we together? Good. Okay, now to be able to build this relationship, the pharmacy technician should know medication. No, should know medication. So, should you know? How will you know when you don't study? How will you know whether the care is to give you the certificate so you can go? Are we together? Yes. See, if there's something I want to advise you, some of you here, probably you have. I'm talking like this because this is practice now. It's not just it's not AUM. We are just be calling them names of drug. This is the real practice now. The course is the practice itself. Two of us. That's why I'm talking like this. If I'm teaching any course, I will not go this. Some of you are already working in one place. Maybe what you need is your what? Certificate. Forget those things. See yourself as somebody that is not even working. See yourself that you are here to learn. Are we together? Yes. Because if you have that mindset, let me come and get this certificate and go, you will know nothing. If you get that certificate, you go back and continue that thing you were doing that time. You continue like that. Is there any difference? No. Or if you forget whatever you think wherever you think you are working, whatever you think you are doing, tell yourself, I'm here to learn. I am here to learn. They say, I'm here to learn. I am here to learn. And it's when you open up yourself for learning. When you open up yourself to learn, that's when you actually see that you don't even know anything. The more you strive to learn, the more you realize you don't even know anything. Yes. The more you say, now, the more you get a textbook to read, the more you read, the more you realize that you have a lot to do what? To learn. But if you close up and tell yourself, what am I going to do here? Let me just I'm already working. I have a place, I'm doing business, I'm making millions a month. They pay me, let me just do anyhow I do it. I just give up, let me go my way. You are not helping yourself and you're not helping your patient. Am I communicating? But if you put a say, there's a reason why this place was established. This program was established. I'm here to grab that reason why it was established. Not the end. The end is what certificate. But let me pass through the process. So I can get something additional to what I have been doing. And by the time you start doing it now, if you start comparing what you are doing and what's happening, what's going on here, you start seeing that there are a lot of things you are doing that were awkward. And you may even start beating your chest. Hey, I messed up. But anyway, I didn't know. You started it. Are we together? Yes. So you need to know what? Medication. Then you know about drug distribution system. You also know your what? Pharmacy what? Calculations. I think that should be your second year course. Your second year course. You know your pharmacy calculation. You know your pharmacy, okay?
My question is not based on that index.
MDEX, okay?
For we that don't have money, if you buy that first statement, if you are not interested, if I see that, it's meaningful.
Of course, meaningful, of course.
If I'm not interested,
will I collect your money? See, what happens is this, What happens is this. I told you that it's from the company directly, and they don't send out 111.
Another 10 people.
Of course, anytime. If you want it 20 times a week, I will send the do it. I don't have an issue. The minimum problem. Please let me but They say the shift from the topic is N. I'm 15. Is from 10 up. When I was not here, down. They send it down. So I am even close to the door because the office is here in Lagos. So where? Huh? How much? 50,000. You said hello. I want together. 1 hour, please. Where did you hear? Where did you hear 55 in the market? Where? No, it's 50. But should be America here, right? Yeah. They say 15,000. Yeah.
You're not paying any charges.
No. Just pay 50,000. Those send it. Huh? Rest more. Hello, are we together? All right, let's continue. Any question? I'm coming.
From the rules of the pharmacy technician, it's not clear that a pharmacy technician cannot stand alone as a own a pharmacy. Yes.
Okay. Hello, she asked a question. She said cannot own a pharmacy. Okay, let me explain. Do you know this? Do you know there are two factors? Okay, you can come. Okay. Please come and teach us. Come. Come out. Princess, they come. What you come out? He doesn't. I said you don't teach. But come and start from where I stopped. Are you sorry? This you just be generating noise around you.
It is deep voice.
And after that, you stay as if you're not the one that.
Yes.
And people around you will just be laughing, and they will be caught. But I know the source. All right, now let me answer your question.
Yes.
See, there are two factors. In play here. One factor is that under normal circumstance, you see all this after pharmacy. We have pattern medicine. Under normal circumstance, this is what the pharmacy technician should be running. This is what the pharmacy technician should be running. But because of one, how the shop evolved, but how non-professionals hijacked all these things from the beginning. Am I communicating? Now, in fact, they not. In fact, before even pharmacy even evolved like this, pharmacy were even hijacked by non-professionals. Yes. Before with time restriction now started entering. When you now that now you cannot before you operate a retail pharmacy, you must be a pharmacist officially. If you see a retail pharmacy that is not owned and operated by a pharmacist, there's something like this there. It's either they presented themselves as retail pharmacy, but when you now go to the place, they are doing something else. Am I communicating? Which each time they want to come for supervision, they will just do as if they are doing wholesale. Am I communicating? Yes, because if you are not a professional, you have no business with patients. All you need to do, but you can run a pharmacy business. You can be doing wholesale. You can be doing the distribution. Fine, no problem. What you need is to employ a pharmacist that will register it for you. You will do your importation and do your wholesale business, or even your manufacturing. But once it comes to, you will sit down and be attending to a patient. Once it's a pharmacy, a pharmacist should own and sit down there and work. That's what it should be. Are we together? Should own and sit down there and see these patients and know what they need. If you wake up today and go to PCN and say you want to register pharmacy, what the faithful people will ask you, are you a pharmacist? You say no. You will tell you cannot register retail pharmacy. You tell you clearly. You cannot register retail. If you most of these retail pharmacy you see around that are not owned by pharmacists are actually most of them are old. Most of them are old pharmacists that registered those days when this law did not come. So they didn't know what to do again. They allowed them to continue because they are old. Am I communicating? Recently now you cannot be allowed. So unless the person now, unless you come to me and tell me, go and present yourself as the owner. How come every business is my own? You have no mouth in it. Collecting. You don't appear there at all. That's why I don't like it. Me annually, I'll go there and tell them that I'm doing that. If I go there and tell them that it's me that paying you. You get capital and disappear. Hello? You bring capital and disappear. You have no business with that. Yes. Your own is at the end of the month. You come, will do accounts. You can share and give it away. Yes. Can you open hospital by yourself like that? See, if you open hospital, hello, if you open hospital, you have no business with patients in the hospital. I want to hear that. If you open at a hospital, you have no business with patients. I'm coming. I'm going there. I'm going there. I am not done now. I'm coming down. I'm coming to your question. As an entrepreneur that have money, you want to invest in healthcare. You can open the hospital, get a CMD that will be there, register it, but you have no business with sitting down there and seeing patients. Admin is not a clinical work now. HR is different. I'm talking about seeing patients the same way. That's what they're trying to avoid in clinical, in retail pharmacy. Because most of them will come and sit down and be seeing patients. You're not doing that. So that's good. Now, let me now come back to your question. Have you not seen how non-professional now hijack this and gradually now they now start to having a streamline that this is that. Am I communicating? So anybody now is somebody that is greedy and want to look for trouble, that will keep living a life of like this, that will go and they mingle with somebody like him and they will go and register a retail pharmacy as wholesale pharmacy. They register it as wholesale, but they are practicing what? Retail. Because if it happens, the fault is from the pharmacist. Hello? Good. Now, that one is defined now. Now, before this issue of pharmacy technician started coming up, people had already gone to start opening pattern medicine. And these things, why PCN have no choice than to allow people, they will come, they will do that. So sometimes they will carry out one or two trainings for them, is because the grassroots needs these services, and there were no capable hands to handle. Am I competing? That was why they, because you cannot say ideally is not what it should be, but a reality. If you close them down, bam, there will be a problem. True of us. Now, with more famous technicians coming up now, if you have a capital, that is what this is your where you should make your own. And I've seen a lot of it's not pharmacy. Hello? Hello? If you are here, if while you came here, there is this saying, I don't know how you say it in Yoruba. There is saying in our side, I'll say, Okwarage, as in nothing for you. Nothing for Yoruba. If that is why you came here, sorry to inform you that you cannot use a pharmacy. You cannot open. Listen carefully. Hello? Can I ask a question? Can I ask a question?
Yes.
Can I ask a question? Can I ask a question?
Yes, sir.
This is hello. This is pharmacy technician practice.
Okay.
Now let me tell you. Let me ask you a quick question. If you know, you were told, and you believed that after this place, and that's why you came, that they give you license, you go and open a pharmacy. Raise your hand. Okay, now. Hello, let me explain. Now, okay. Hello, can you sit down? Can you sit down? Can you sit down? Out together. Now. in this present day now, a pharmacist that can open any human being on earth can own it. But what you do is this, listen carefully. What you do is this, that we register it, register and work there. But for me, a pharmacist, blah 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 blah. That's who I am. So I told myself, so immediately after the church, immediately after the mass, when it's a guy, one woman, I can't recognize her face again. She came, hey, hey, first of practice. Also, no, she said she is a community pharmacy. The owner is what you want to. I said, I laughed. I said, are you aware that as a nurse you cannot register a retail pharmacy? She said yes, but that's how we do it now. I said okay. So I said so I will now register it. So when they now come, go say, I told that I less. I'm like a fowl, and when a fowl, she said yes, 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 yes. That was how we ended the church. Can you recognize her? So this say I typically, you know, so that do. Am I complex? That's why I say if you see apart from those old, our forefathers opened that time like that, because they don't know how to go about it again. I'm talking about now. If you see a community pharmacy where they see patient and they wrote in pharmacy and it's really registered, ask for their license of the premise. What you see there is wholesale. You will not see it again. Just do this simple experiment. There is no little pharmacy. Pharmacy is pharmacy. What we have is pharmacy and patent. Now, for that patient interaction, by virtue of your training, remember I told you something. There's something I told you. In as much as PCM regulate the practice, they are also mindful of reality on ground. Okay. The reality on ground is that non-professionals have gone before this training assumed. Non-professionals have gone before patent medicine shops. Am I completing? They cannot just open their come and say close it down. No. That's why if you watch and they in that way, they would encourage some of them to go and do pharmacy training. They organize, encourage them to do pharmacy technician because they know that with the future most of them that are open, that have pattern medicine now, those that have foresight, started enrolling in formal secretion training, because time will come when it will be clear that it's only formal technician that can run pattern medicine for the future. The same way it took time to rule out as only pharmacists that can run retail pharmacy. This is the future now. Where we have to talk to the so if you have friends that are running pattern medicine, it will remain like this. No, you are here already now. Okay.
I came to inform you that you have to bring your company's uniform. Okay. Your company's uniform. They cannot use to tell you don't have uniform, don't have it. The capturing for if you not gotten uniform, I'm sure everybody has got. No, they have not gotten uniform. If you not gotten, you can use someone's phone and capture. The capturing and the thumbprints I'm going to work with also a thumbprint. But that effect is for people who have paid is 50% of the tuition. 50 or 60. It's 50% of the tuition. So if they're not paying 50% of the tuition, you won't be allowed for that capturing. So that would seem to be that Tuesday. That's Tuesday morning. So you to meet up your payment 50-60% to meet up for that capture. If you not pay, you won't be allowed to capture. Thank you.
All right, thank you. No. Here's a question. What's the question?
I said.
Sorry. Hello. Here's a question. I've answered a question. Ask a question.
My question goes like this.
Okay.
If you have credits for that and you want to
yes.
How will you start?
Let's see that. Okay, so someone ask a question. Hello? Someone ask a question. Are we together? Yes. Someone ask a question. How he or she will register chemist? Yes. Remember what I told you? I said in the near future, it's only formal technician that can register it. This your annual period you are looking will now be in full force that you without it you cannot register a pattern. But for now people that are not formal technician are still registering. As at the time I followed up last. Hello. What's going on there? Please, what's going on there? Lecture is still going on. This is wrong. This is so wrong. Lecture is going on. If you want to leave lecture on time, take excuse and leave. After you can do that thing. Now, as at last time I followed up after messing this thing, I know that anybody can go there. Once you meet the requirements, you will register. As at that time, I followed up. But now, I don't know whether they are started enforcing formal secretion license. I don't know for now. But I know that in the near future, it will happen. Huh? Yes. Hello, someone is talking now. Yes.
Which place can we find ourselves?
No. Without your license, without your license, if you apply for a job now in any hospital that is serious, you ask about your license. If you apply for job as a formal technician in any hospital that is serious, when I say serious, I consider that some of these private hospitals some of them don't care. Let me use government hospital now. That is serious. If there's no more government, you must present your license. That's what makes you a pharmacy technician. Huh? Which business are you talking about? Well, remove your eye from pharmacy. It's not for you. What's all this? Hello, please, listen carefully. Hello, sit down. Listen. Hello, listen. Are you with me? Hello, are we together? Can you listen to me? If you want to be a pharmacist, go and write jam. Or wait, after you enter to that. What's the problem? You want a pharmacist? Yes. What's the issue? I've told you who can run a retail pharmacy. What's the problem? If you're angry, go and write jam. Or after here, go there for that entry. What's the problem? See, anybody, I'm saying it without mixing words. I am saying it without mixing words. Anybody that told you that after this training, you will register a retail pharmacy and run it legally has duped you. Did he listen carefully? Did he tell you retail pharmacy? No. It's okay. You will hear anywhere you go. So just listen. I said retail. Be careful. Listen to me. You are here to learn. See, if you are saying you want to go whatever because of it, did he tell you retail pharmacy? So calm down. Mother, calm down. Pharmacy is not for pharmacy. Pharmacy is not pharmacy. I can never be what pharmacy. Pharmacy is of categories. That's fine. But you must employ a pharmacist in that hostel. If you want pharmacy, if you want to be a pharmacy. See, if you like arguing from 90 today, I'm sorry. Alright, so let's continue. Hello. No, you cannot. Someone is asking a question. Can we listen to her?
As a patent medicine dealer,
yes,
we are told not to sell antibiotics.
Okay.
But now, as a pharmacy technician, are we going to be selling antibiotics? So that's my question.
As a what?
As a patent dealer that is not under pharmacy technician before, we are told not to sell antibiotics.
Okay.
But now, as a pharmacy technician, are we going to be selling antibiotics?
Hello. So far, you are running a patent medicine shop. Patent medicine. Whatever is in the PCN guideline follows. Until remember what I told you. I said that non-professionals, just like about few years ago, call it 10, 20 years, 30 years back, 40 back, pharmacists were few. Non-professionals were in the profession, selling drugs up and down. Until most pharmacists were trained, they took over as their what? Profession. The same way now, with time now, this thing you are seeing now will be taken over by what? Pharmacy what? Technician. That is when these things, the issue of whether they can sell other things, things will be revealed by the virtue of your training. Do those people have that training? And so is life. There are people that founded something that, and they didn't even enjoy it. True of us. Some things we enjoy today, people build the foundation and they died. But you are reaping the beginning now. So what's the problem? Be coming down. Sorry that you came now. That this is your what generation. Maybe it may be the future what. Like me now, as I'm here now, I am reaping the fruit of what other. Before now, was there anything like internship in when you graduate? But I enjoy internship money. But there are older colleagues that did not enjoy like that. But they fought for it. It's not their fault that they came in that world generation. So yes, it's like this now, but with time things will do what? Normalize. I'm sorry that you came in this world generation.
Yes, sir.
So calm down. I've told you the simple truth too. The simple truth is this: if you want to open and run a retail pharmacy, then go and study pharmacy. It's a simple thing. Then if you cannot, then it shows that it's not for you. Know where you belong to. What's your problem? This life is so simple. Two of us, it's so simple. Hello, okay. Hey, someone asked me, hello, are we together?
Yes.
Someone asked me a very important question.
What is the question?
She asked, hope pharmacy technician license is recognized outside the country.
Yes.
In fact, listen. Search pharmacy technician in USA. Search pharmacy technician in Canada. Then you see. In fact, no, pharmacy technician. Listen carefully. Hello. Can someone here now, right now, search pharmacy technicians in USA? Another person search pharmacy technicians in Canada now. Now listen. Now let me tell you. Just listen. Can you listen? Just like every other profession. If you like, be a medical doctor. If you like, be a pharmacist. If you like, be a technician. Your pharmacist is in Nigeria. If you cross the borders of Nigeria, even Ghana here, if I cross the border of Nigeria and go to Ghana as a pharmacist, I must write their license exam, the exam. And if I pass the exam, they will issue me their own license before I can practice there. I cannot use my license as a pharmacist in Nigeria and go to Ghana and practice. It's not going anywhere. Am I competing? So if Ghana here can mandate me to write the exam, the same way, if you take your business as a former technician and go to any country, they have their own. You write their own exam. If you pass their own exam, they issue their own listing. Am I competing? So that one is because some are saying, so what are we going to do with our license? That question is funny to me. It's funny. It's even that what you will show them before you even write their own exam. You cannot just come from anywhere and say, I'm a pharmacy technician, and they give you the exam to write. No. You will show, you give them what shows that you're a pharmacy technician in Nigeria. Because they believe that once they see that your license, it means that you went through the training. It's when they see what show that you are in the country you claim you are coming from, and they will verify it. They will contact PCN to check if your name is in the register of PCN. Okay. So this induction you are doing here is not a child's play. If you like, go to Canada and say you are a foreign technician in Nigeria. Canada, through the embassy, whatever, they will contact PCN in Nigeria to check if your name is in the register. If your name is not in PCN register, you are in trouble. But if it is there, then you are qualified to write your own exam. If you write it and fail, you keep writing until you pass it. Then if you pass it now, they will not give you their own license. You cannot practice in their country. So it's not a child's play. You very industrial here, right? Okay. You are first years. That thing you see the industrial, it's not a child's play. PCN will come, write your name in their register. There were situations whereby nurses, some people that claim that they're nurses, and they go to US, they have to try to find out their name is not in Nigeria's register, and they were what? Deported. Are we together? So it's a serious thing. It's a serious thing. So what you are doing here? Hello. And people haven't heard except. Do you know why I'm doing all these things? Because this is the practice we are talking about now. You need to know all these things. But take my word to anywhere. Any human being on this earth that open his mouth and tell you that you can open and run a retail pharmacy legally, not by corner, by claiming that you are doing wholesale in the office of PCN. When you now go back to your office, you start doing retail. Except when they want to come for this thing, you clear everything and do as if you are doing. For how long will you live that type of life? Am I communicating? So except you are doing it that way, I mean legally, officially, both in your office and PCN, you are not a pharmacist and you are running retail pharmacy. It's not true. Except those who they were all who pharmacists that time. That they just, because personally, apart from what we studied in school, how I had a personal, are we together? Yes. I had a personal experience on that. I had a personal experience on that. There was one old man I worked for when I started. I noticed that the man, okay, it seems we are tired, right? My duty is to be hitting you with the truth. If you like, he pay you. If you like, you'll be happy. I read it to you steady. You must not be satisfied. Injection. No. All right, thank you very much. See you next time.